Hi, everyone. This is Kylene Dibble, the Executive Director of Parents for Public Schools of Pitt County. We are so happy to be here today doing yet another question and answer session, this time around vaccines and why they are so important for your family. I have two women joining me today, and I'd love for each of you to introduce yourselves. Dr. Hardy, can you go first?
All right. Hello, everyone. My name is Dr. Kimberly Hardy. I'm a nurse practitioner and the Director of Nursing here at the Pitt County Health Department.
Thank you. We're so glad you're here.
Good to be
And
here.
hi, I'm Karen Harrington, Director of Student Services, Pitt County
For
Schools.
being here. So we are going to ask a series of questions today specifically about vaccines. And so we'll ask the question, and then each of these women knows which questions are theirs to take. But we'll start right off with our very first question. Dr. Hardy, can you tell us why vaccines and immunizations are so important and why they're required?
Okay, I'll start with a short answer and then give you more of a detailed answer. They're important simply because they protect our health. That is the simplest answer I can give you. But I think that's not enough of an answer. So let me tell you a little bit more. I think in 2020, I think all of us have come to realize that communicable disease is certainly a threat to our health. COVID-19, the pandemic we're currently in, is a prime example of why immunizations are critical to protecting our health. Immunizations protect the health of everyone in our community. The viruses and bacteria that cause illnesses, vaccine-preventable illnesses specifically, and death, they still exist, as evidenced by COVID-19, but also with the ones that we're traditionally familiar with in name only. So measles, mumps, rubella, Haemophilus influenzae. We are familiar with those terms, but many of us have never seen the disease and the disability and the heartbreak that those diseases cause, because we've had vaccines in place for most of our lives. For those of us who are parents now, we don't know a time when vaccines didn't exist. But I'll tell you, everyone on this call who's listening or replaying this Zoom meeting has been affected and felt the impact of our current communicable disease outbreak. We have been experiencing the effects in the United States since February of this year. And as of October 2nd, communicable disease has affected over 34 million people across the world. It's caused 29 deaths here in Pitt County, 3,600 deaths in North Carolina to date, and just under 211,000 deaths in the United States. We're learning now, and we see all of the production going on right now for COVID-19 vaccine. We'll just kind of replace that with measles, mumps, rubella vaccine, polio vaccine, chickenpox vaccine. We have the same type of death and disability risk if we did not have the vaccines in place. So when we talk about protecting our health, it's not just our physical health, it's our emotional health. Many of us have watched loved ones suffer from the loss of losing their health and their functioning, the loss of life, the loss of their income. Our unemployment rate rose sky high, 12.9% in April in North Carolina. Some people have even lost their homes. So when we look at vaccines and the importance, it not only protects our health, it protects our sense of peace and safety as we live day to day. And I think as parents, as individuals, in 2020, we have learned we can't expect to continue to live our lives in the current fashion or in the fashion that we previously knew if our health is at risk, if the health of our families are at risk and the health of our fellow community members are at risk because of communicable diseases, and particularly vaccine preventable communicable diseases. So that is a long answer, but I hope that it gives you a good feeling for why it is so important for us to have vaccinations.
Absolutely. Thank you so much for that just inclusive answer. Um, we we really want to talk a little bit now about vaccines that are specific to what's needed in Pitt County schools. So, can you tell us which immunizations and health assessments are required at each grade level and age?
Sure. So I'll start by telling you that the reason the vaccines are required is because one, it's required by state law for many of the reasons that I just stated, and that there is a protective effect that's achieved when the majority of our population is immunized against the various diseases. So those are the baseline reasons why we need them. Now for kindergarten, and I'm going to see, I'm not sure if I can actually
You can now share your screen.
Okay, wonderful. Let's see, I think I want to share that one. There we go. North Carolina Immunization Branch has done a wonderful job of giving us a clear picture of what's required for students to go back to school. So for kindergarten, not much has changed. And I'm going to scroll down here with this. Can you all see this okay, the screen?
This is very helpful. And parents out there, this will be a great resource to go back to and see it written down what your child needs for kindergarten, 7th grade, and 12th grade. This is fantastic.
All right. So all kindergartners need these vaccines. And every year, kindergartners are required to have a health assessment. So when parents, when you take your children to get their kindergarten physical, their provider, whether it's a physician, nurse practitioner, or the local health department, we will take a look at the immunization record and make sure that the immunizations have occurred in a particular interval and have the specific number of doses that you see here on the screen. If those immunizations are delinquent, the provider will have the nurse give your child those vaccines at their well child check, which is great. So you only have to have that one visit for well child check and the vaccines. But if something happens and your child falls off schedule for their well child visits, a lot of times you can lose track of the immunizations and your child falls delinquent with their vaccines, which could be a problem for their health. So we want to make sure that all kindergartners have 5 DTaP, 4 polio, 3 to 4 doses of Hib. It just kind of depends on when that last dose was given, at what age. They need 2 doses of MMR, 3 Hep B, varicella, 2 doses, and the pneumococcal conjugate vaccine, 4 doses of that at kindergarten. I will tell you, this is a lot for parents to remember. So the school system understands that. So they ask you to submit the health assessment form and the immunization record. And they take a look at this record. So you've got a lot of help, a lot of people trying to assist and make sure that the children have their vaccines on time. When the school receives it, and Karen, correct me if I'm wrong, but when the school receives it, they have personnel who look at your child's record and make sure that their immunizations are up to date. And they can only do that if you give them the form when they ask for that during that time period. Now, this year we do have a little bit of an extension, and we're getting that written at a close countdown for that time period. But we have a lot of help at kindergarten and at 7th grade. If you'll take a note before I slide down on this screen, you will notice that many of the vaccines that are listed in the kindergarten line here are also in the 7th grade. There are only 2 vaccines that are new that are required at 7th grade, and that's Tdap and the meningococcal conjugate vaccine. We call it Mynactra. So there are 2 vaccines that are needed for 7th grade. So if you took your child for their well child check when they were in kindergarten, you've been keeping them going every year as recommended by the American Academy of Pediatrics, your child will be up to date with their vaccines, or at least they'll get the Tdap and the meningococcal conjugate vaccine when they are in the 7th grade, or approximately around 12 years old. Scrolling down to the 12th grade, you'll notice again, I'm looking at the number of doses. And if you look at the comparison, DTaP to in the 7th grade, DTaP to the 12th grade, and going all the way down the line, the only new thing here in the 12th grade is the 2nd dose of the meningococcal conjugate vaccine that's required. So that is new for this year, and that will throw so many parents off, because if you've been taking your child to the doctor, or if you had children who were previously, have gone on and graduated, you use your memory to help you know when to get your child their vaccines. Well, it's changed. Times are changing, and the immunization schedule changed again. And it's time to get your 12th grader a 2nd dose of the meningococcal conjugate vaccine. So these are the vaccines that are required for kindergarten, 12th grade, kindergarten, 7th grade, and 12th grade. And this is available online if parents want to take a look at this. I can't, because of the screen, I can't really show you the entire, well, I guess I can, there you go. But you can't read it. So you can't see the whole thing on the screen here, but if you go online and you search North Carolina Back to School immunization requirements, you can look at this there, but you have resources with the school system and with your local pediatrician or your child's healthcare provider to help you stay on track so that you don't have to remember all of this. It's a lot to keep track of.
Thank you so much, Dr. Hardy. I believe we can see all of it. I can on my screen, so hopefully folks at home can see everything on their screen. But as she said, your pediatrician also has this information, and you will definitely have help in remembering what's needed. Let's see. So if parents want to get their children vaccinated, or they need to get a vaccination, it hasn't happened yet, maybe. Where can they go to get those? And maybe are there clinics, or do they need to go to their pediatrician? Talk to us about where it's available.
Sure. Well, and I'll stop sharing this screen now. I realize I'm still sharing. Okay, so fortunately, I'd probably say fortunately, not much has changed in terms of where parents can go to get their vaccines. Their well child check is very important. And the first thing I want to say is that your pediatrician, your child's healthcare provider, is the first place that a parent should go to take their child to get immunized. That is extremely important. There's so many other things that the pediatrician does in addition to immunizing the child. However, if you are new to their area, or if you have some issues with getting an appointment to see your pediatrician, you can also come to the local health department. Now I'm going to tell you, everybody in, I'd say, Pitt County and certainly United States, you've noticed that the access to care has decreased. The appointment availability, appointments are maybe 2 months out now. And it's mainly due this year to the pandemic. But usually when parents want to get their children vaccinated, you really got to start thinking about that probably as far back as January to make sure your kids are vaccinated. This time of year, though, in October of 2020, I would say that call your pediatrician and see if you can get in. Many of them are booked at this point. Our health director, Dr. John Silvernail, has contacted our local pediatricians and has expressed the issue that we have with making sure our children are immunized, and our local pediatricians are working to have some availability. Additionally, Pitt County Schools has been gracious and very proactive. We've been working for the last year and trying to help make sure that we make sure our children are vaccinated in our community. So we have Pitt County Schools, Pitt County Health Department, and Vidant Health Center with their school health program. We are working now to plan some immunization clinics here in Pitt County because we recognize that COVID-19 has greatly decreased access to those immunization services that parents usually rely on with their pediatricians. Those dates, we don't have those dates yet confirmed, but we are nearing the end of the assessment of determining how many numbers are in need, the number of students that are in need, and we will make our publish the dates for those clinics very soon.
So sort of a summary of where to go to get your vaccines. If your child has not yet received them, you can call your pediatrician, you can contact the health department, and you can keep an eye out on Pitt County Schools website, social media, Parents for Public Schools social media, and we'll be sure to share the clinic dates as soon as those are set. One thing to just point out very quickly, October 30th is the key date that we're looking at. So if your child has not yet been vaccinated, kindergarten, 7th grade, 12th grade, 5 years old, 5-year-olds, 7th graders, 12th graders, they need to be vaccinated by October 30th. So please contact your pediatrician, your health department, or keep an eye out for one of these clinics that will be coming very, very soon. We are going to move on to the next question. So a lot of people are asking right now, Dr. Hardy, is it safe to get immunizations, sorry, during the pandemic? And what types of precautions are happening at doctor's appointments and health department appointments and things like that to make parents more comfortable?
That's a great question. I would say it is not only safe, it is critical. For the reasons that I've already mentioned, the other communicable diseases, we only have protection from those if we are immunized. Many of the symptoms of the other vaccine preventable diseases are similar to COVID-19. We would not want to have an outbreak of, let's say, measles on top of a pandemic of COVID-19 in our community. So it is critical that we are immunized, not only with MMR, but influenza as well. Same situation. The symptoms are very, very similar and require some diagnostic reasoning and testing to determine which disease is actually responsible for the symptoms. Now, doctors' offices and the local health department are taking several steps to help ensure that as the parents and the children come into the practices to get their immunizations, we want to make sure you're safe. So many practices are performing screening. Actually, I believe all practices are performing health screenings at the door. They are checking temperatures. They are asking a series of questions to determine risk and presence of symptoms that are consistent with COVID-19 to help prevent those who may have symptoms and risk factors from entering into the lobby. Other practices are additionally having patients wait in the car. So they really only come in when it's time for them to come in the building. So they're not waiting in the main lobby area with other people. Governor Rick Cooper certainly has, I think we all are aware that we have mandated use of face masks. And so pediatricians and the local health departments, healthcare providers in general in Pitt County are required by law for everyone to wear a face mask and to use hand sanitizer when they enter into the facility. Many have a separate waiting room for people who do have sick symptoms or who have symptoms of COVID-19. Some practices even have different locations away from their main practice where sick patients go. So some facilities are well facilities where only patients who do not have symptoms come in to that facility. And if they don't have another location, they may have a separate entrance. So there are several precautions being taken to protect the health of our parents and our children, and typically just everyone in the community to make sure they are safe when they access healthcare services.
While we're on that subject of it being safe to get vaccines during a pandemic and what vaccines we should get, what are your thoughts on getting a flu shot this year?
Get it. That my thought on that hasn't changed. I get a flu shot every year. Similar to COVID-19, influenza has a higher mortality and more serious complications in people who have chronic diseases. Typically, a lot of people don't get the flu vaccine. Most of the people that I talk to, when I ask them the question, "Hey, you getting a flu shot this year?" Some of them say right out of the gate, "No, I never get a flu shot because it gave me the flu." Well, I have to speak to that real quickly. The flu shot does not give people the flu. The flu vaccine does not contain any live virus in it. It's inactivated. What may happen is that there is a period of time where the vaccine is given and the body produces the immune response to protect itself against the virus when it actually is presented. And that window of time where the immune system is building, you can be exposed to influenza virus and you may develop the flu, but you did not get it from the flu shot. It did not come from the flu shot. So I want to make sure I say that. Absolutely, I want to encourage everyone, including anyone who has a chronic disease, hypertension, diabetes, heart disease, obesity, any type of chronic disease, and people who are well, please get the flu vaccine this year.
Thank you for sharing your thoughts on that and your expertise. If someone, let's start with this question first, actually, Ms. Harrington. I think we're going to move towards you a little bit. And Dr. Hardy, you may have some to add as well. But, right now we have students learning at school, and then we have some students who are 100% virtual learners. Are those virtual learners still required to get their vaccines and turn in those health assessment forms this year?
Yes, they are. And that probably is a surprise to people because the students are not coming in the school. And excuse me, I think Dr. Hardy probably can speak to this better and more eloquently than I can, but that my understanding is even though they're not coming into the school, they are going other places. And so we certainly would continue to want to have them be properly vaccinated and have those. And so the state is still requiring them. As you mentioned earlier, Ms. Dibble, the state did grant us an extension this year because they knew that the clinics and the pediatricians' offices were backed up from being closed previously earlier in the year. And so that extension, typically Wednesday of this week would have been our deadline, but it was extended till October 30th. And so it continues to be important, not only for the health of our community, but for whenever students do return, or if they want to return for sports or other programs, that students without that vaccine will not be allowed on campus.
That's exactly, I agree with what you said, Karen. Herd immunity, I didn't say anything about that when we were talking earlier, but this is more than just a rule, the immunizations requirement. It really takes everyone getting immunized to give protection for our community for vaccination. And if you're vaccinated, let's say for hepatitis B, that does not convey herd immunity for the other vaccines or diseases that we have vaccines to cover. So just to say real quickly that herd immunity is protection that we experience when a large portion of our community is either immune because of vaccination or actually having acquired a disease. And it protects the spread, it prevents the spread of disease to people from person to person for people who have not been exposed. So herd immunity actually helps our whole community be protected against a vaccine, not just those, not against a vaccine, I'm sorry, against a communicable disease. It does not just protect those who are immune. So, and I don't think any of us want to become immune because we got the infection. It would be much better to become immune because we got the vaccine.
Thank you both for that answer. I think our last question for today is, so that October 30th deadline it's not far away. And so what does happen if someone does not get their immunizations or does not turn in their health assessment form, or both, by that October 30th deadline? Is there a chance they may not be able to go to school?
So yes, unfortunately, and sometimes the school system gets the bad rap for this, but the state law, our state law, says that students that do not receive, or if we don't have record of it already being received, not scheduled, not an appointment, but of the health assessment for the kindergartners, and then the updated immunization records for our kindergarten, 7th and 12th graders, they would not be allowed to continue with school. And in a typical year, they would be suspended from school based on state law. Now, obviously, this year is very different. And so anytime a student is suspended due to their immunizations, they are allowed to continue to access their education through whatever means. And so now we do have the ability to continue to access education through virtual means. And so we would not prevent students from getting their education. However, again, they would not be permitted face-to-face if they were students that are currently face-to-face. And then later, whenever, hopefully soon, COVID goes away and we're allowed to open schools back up to all students, those students would not be allowed on campus.
So even folks learning virtually, we know that could change at any point. If things were to get better next semester and you decided you wanted your child to come back, and then it might take a couple months to get the vaccine scheduled. And so going ahead and getting it now really takes care of making sure that your child stays consistently registered and consistently attending school, whether it's in person or virtual. Ladies, thank you so much for your time today. Families, I just want to give that recap that health assessment forms and vaccines need to be completed by October 30th. And we hope that this has been some helpful information for how to do that and why that is so important and a requirement within our public schools. And Ms. Harrington, you did such a great job pointing out that this is a team effort of lots of folks. And so this is some state requirements, which trickle down to school requirements. The health department is involved in this teamwork. So I think having families and parents and kids involved in that team as well is so important. Yeah. Thank you for your time today. And families, if you have questions, as always, feel free to send a private message on the Parents for Public Schools Facebook page. You can email me at kdibble@ppspittcounty.org. I will not claim to know all the answers, but I am generally able to connect you with the person in Pitt County Schools who might be able to give you the answers. So feel free to do that. Anything you all would like to add before we leave?
I do just want to add that for our virtual parents to just really listen to that information from Dr. Hardy and not think about it in terms of school and whether, if you're not choosing to come back, but the health and safety of our entire community. Again, not about whether you can attend school in person, but about those safety factors that Dr. Hardy mentioned. I learn so much every time I hear her talk about this issue.
Thank you. And I would like to add that, I'm passionate about this. I've been in public health for 25 years, and I have seen a lot of things. And I would have to say that I'm very fortunate, as many of us are in this community, to not have seen a case of measles, polio. I don't ever want to see that in my lifetime. And I do not want any parent to have to take care of their child with these diseases. It is heartbreaking. Again, I think COVID-19 is probably the best example that we could use today that would hopefully prompt us to not only get vaccinated, but get vaccinated on time. Get those vaccines at the age that they're recommended. It helps with boosting the immunity and provide the coverage that the vaccines are supposed to provide for us, for all of us.
Right. Thank you so much, ladies. I hope you both have a great day. And thank you to everyone who has watched this question and answer session. Hopefully you'll join us for another one very soon.